Welcome back on the big stories on the AM show. And up next, we're going to be talking about the Gh Genome Project. What's that? Well, do stay with us. Our guest is Professor Solomon Fifio Foriakwa, who's president of the Sickle Cell Foundation of Ghana. Prof, a very good morning to you. Thank you for joining the conversation.
Thank you. Thank you.
I know when it comes to genomes, people will be thinking DNA, RNA, and all of these are already complex subjects to deal with, but somehow you break them down and you make meaning of them. So let's start with the whole concept of the Genome Project. Oh, what are genomes in the first place, just to break down the conversation before we get into the project?
Right, thank you for inviting me. So a genome is the complete set of DNA that you have. Right. So when I refer to your genome, it's your complete set of DNA, all the DNA you have. And so for every organism, all its DNA, we have one word for it, the genome.
Wow, that's interesting. I also know part of this is the RNA, ribonucleic acid, feeding into all of this. And also very important when it comes to our vaccines, for example. Now that we are talking COVID-19 vaccines and all that. What is that aspect of the conversation?
So RNA is a messenger. So the DNA is the instruction. So DNA is what we inherit from our parents. It stays in our nucleus. And it gives instructions for what we call proteins to be made. But the DNA stays inside the nucleus. And so it sends out an RNA as a messenger to go into the rest of the cell to make the protein. So RNA is basically a messenger of the DNA.
All right, so messenger and sender. If you didn't know, in simple terms, now you know. That's why you should watch the AM show. But let's talk about the GH Genome Project. And I was just having a conversation with Prof earlier about Professor Ahene Frimpong, who recently passed, someone I knew personally, and whose work as far as sickle cell and dealing with it, especially in respect of children, is just fantastic. But tell us a bit about maybe your interactions with Prof, just to set the conversation on this foundation and what you've been doing, what the foundation is all about.
Yes. Professor Ahene Frimpong is a great loss to all of us. We call him Cough. Cough.
Why?
Kweku Ahene Frimpong. That's the abbreviation.
Oh, right.
I've worked with him
for... Prof Cough.
Prof Cough, yes. All around the world, everybody called him Cough. I've known him for nearly 30 years. And he is very passionate about sickle cell disease. He started the Sickle Cell Foundation of Ghana for one purpose, and that was to bring to Ghana the quality care that we know sickle cell patients in the United States and Europe have access to. So that was really COP's main focus, bring to Ghana quality services for sickle cell patients. One of the very first is to be able to screen all babies born in this country for sickle cell disease, because this is what is done in the United States and the rest of the Western world. Every child born in the United States is screened for sickle cell disease.
To give them a head start, in case they do have...
Absolutely, because we know that with sickle cell disease, infections are inevitable, and so you are going to get infections. And so the point of screening early is to then be able to give the children prophylactic penicillin. And so that is the standard of practice in the Western world. Screen babies if they have sickle cell disease. You put them on prophylactic penicillin. And so COP's legacy really is that he was able to, through sheer tenacity and effort, get over 500,000 babies screened in this country from 1993 to 2000 through his efforts. And in so doing, nearly 10,000 identified to have sickle cell disease for whom penicillin was made available, essentially saving these kids from dying from an untimely death early in infancy. So COF, we owe a great deal to Professor Ahene Frimpong for the work that he started here in Ghana.
And work that you are obviously continuing. I think I saw something in recent times in respect of, there have been calls in the past for the national health scheme to include some of these. And I see some inroads are being made in respect of that, all on the back of Prof's work and your work as well as a foundation.
It's largely Prof's work. And it was really fitting that before the memorial service that we had for him, that the government, through the National Health Insurance Scheme, added hydroxyurea, which is the standard treatment for sickle cell patients globally to the essential list. And so the Ministry of Health has added that drug, and the National Health Insurance has added that drug. And so if you're a sickle cell patient, regardless of your age,
now
you have access to hydroxyurea.
Right.
And not only the drug, but also the routine laboratory testing that has to go with being on hydroxyurea. So.
And that definitely is a gain, because that engagement I made mention of at the Kempinski Hotel back then had this as the focus. So
Yes.
at least that being achieved on the back of his demise still is a giant step, and his legacy obviously is going to outlive him. But let's talk about genetics and why genetic health awareness is important for all of us.
Okay. So genetics is really the study, and we've touched on this a little bit, of DNA, of an organism, right? And, we have about 6 billion nucleotides. These are the units of DNA in all of us. And our DNA, we share the majority of our DNA sequence is basically the same. You and I are sitting here, 99.9% of the DNA sequence that we share is exactly the same. But there is that 0.1%, the 0.1%, that is different. And sometimes that difference is what causes sickle cell disease. That difference is what will make somebody at risk of getting prostate cancer in their family. There are families in Ghana that have prostate cancer, and there's a genetic basis for that. That difference can increase your risk of breast cancer. That same difference can increase the risk of several rare diseases. So it's important.
We even know that some races, if I may put it that way, are more susceptible. Something like, African Americans, Black Americans, to prostate cancer, for example, issues.
Absolutely.
So all of these dynamics, it is through these sequencings and others that we get to know and, of course, protect ourselves from them.
Exactly. And this is why it's so important that we make genetics part of our national conversation. Because, the genes that you inherit influences so many things. It influences your well-being, your health, but it can also put you at risk for a disease. And so the Gh genome, our ultimate goal is to increase awareness about the role genetics play in disease, and also to make policymakers aware so that they can help us develop programs to train genetic health workers so they'll be able to do their work. For instance, we've started a first-of-a-kind master's program in genetic counseling at the University of Ghana. This is the first, actually, in sub-Saharan Africa. Because the most important part of genomics is really the communication. You can do all the fancy work in the laboratory, but you need somebody to be able to explain the complexity of DNA to an average person. And genetic counselors are the ones who do that. And so Gh Genome Project is multifaceted. Is to raise awareness, is to train Ghanaians in genetic health, and also to make noise so policymakers will pay attention to genetic diseases.
You keep mentioning policymakers. I don't know what your take is and how much we're doing as a country when it comes to some of these. Of course, we made mention of the hydroxyurea end of things, but how much we've done in terms of other aspects of this. I also know that on the back of COVID-19, for example, DNA sequencing and other things, sequencing of sometimes these viruses, has come to the fore.
Yes.
How important is it that we do these things in respect of diseases?
It's critical. And, COVID was bad, but there have been some good things come out of it. My colleague, University of Ghana, Professor Wandari and his team and colleagues in Noguchi did a great job, fantastic job, sequencing the variant of COVID that was basically affecting us in Ghana. That was very useful because just like there are variations in our DNA sequences, viruses that infect people also have little variations here and there.
And so they mutate and all
They mutate and all of that. So it's very important for Ghana to have the capacity to sequence viruses that affect us, even though those viruses may be sequenced elsewhere. There may be little differences that will be found in the ones that come to Ghana. And it's important that we have the capacity to do that. And that is relevant, again, in terms of vaccine, how effective vaccines will be. And so overall, COVID has shone a light in this gap that we had. But, colleagues in Eugene as well as elsewhere are really stepping up and doing that. But that is for the viruses. What has been lacking is a focus on human genetics. And that is what our Gh Genome Project is about. It's about the genetics of humans, not viruses or bacteria.
Of course, both of them go hand in hand if
Yes.
we want to make advancements in medicine. But
Absolutely.
focusing on the genomic details that you keep making mention of, how relevant is it or how crucial is it to have especially those of children?
Oh, so for our focus on kids, children, is really so that the genetic information can be useful for their treatment.
Okay.
So
along the course of their lives.
yes. So in this country, every year, probably about 14,000 babies are born with sickle cell disease. So 1 out of every 50 live births is sickle cell disease. Sickle cell disease is more
That's
complex.
quite a number,
Yes.
1 out of every 50.
Yes, and it's more complex than we appreciate. We all know SS, SC, but there are other forms of sickle cell disease that are not so well known to the Ghanaian population. Sickle beta thalassemia, for instance. Sickle beta zero thalassemia is as severe as sickle cell disease. And yet, the inheritance of sickle beta zero thalassemia is such that one parent, when they do a sickle cell screen, will actually be negative, and the other parent will be positive, and they might have a child with sickle beta zero.
So in that instance, contrary to the popular view that you must have 2 sickling cells, 1 from each parent, in that instance, just 1 parent is enough to create complications for the child.
Well, 1 parent is not enough, except that the other parent also has a blood disorder, but it's not sickle. It's called thalassemia. So
blood disorder plus the sickling cell, and then you have a problem.
Yes, you have sickle cell disease. And so our focus on children is primarily so that the sequencing information will be useful. So in as much as there are lots of children with sickle cell disease, the degree to which they get sick differs. And some of that clinical differences is in the DNA. And so we want to sequence the DNA of children with sickle cell disease so that we understand the nuances of some of these clinical expressions. Apart from sickle cell disease, every year there are 400 children that get diagnosed with leukemias, cancers.
That is from the blood and others.
Yes, get diagnosed with cancers. And for some of these cancers, understanding the genetics of the cancer will help in the treatment, how well they are managed, and so on and so forth. So our focus on children is really because they are the ones that we believe the sequencing information will be put to use. There have been
much more than adults, obviously.
Well,
because if they've lived into adulthood, well, at least they've had some appreciable the challenges and all of that.
Yes.
But better deal with the children and give them a better future, right?
Yes, adults are not going to be left out entirely.
Right.
And so breast cancer, we've touched on, prostate cancer, we've touched on. These are also diseases that can have a genetic component. But our focus really is on children because they are most vulnerable in our society. But then once we get the ball rolling, adults will be welcome on board as well.
Now that you mentioned this, just out of curiosity, and correct me if I'm wrong, I know for cervical cancer, I think there is a vaccine of sorts that can be given. I hear it's pretty painful, but it saves you of the wahala, later on in life.
Yes.
Is there any approach you have towards that? I know in other, more wealthy nations, this is being done right from childhood at a certain age. Is that something you're pursuing?
We are not specifically pursuing that, but now that you brought it up, cervical cancer is basically eradicated in the Western world because they are being screened.
Right.
And so really what needs to be done is early screening to identify potentially folks who have it, and then treatment can be given. Screening is really where we are falling behind in cancer. And if we can really do that, it will help a great deal.
Beyond sickle cell, we've spoken about other, aspects like you've just mentioned. Pretty long word, a tongue twister. You just mentioned the one where you have a problem with the blood and then you have a sickling cell.
Oh, thalassemia.
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 Okay.
Yes.
So there are different things you're looking at. Beyond this, are there any other insights you can give into other aspects?
Well, of genomics generally?
Yes.
The key
in terms of the diseases and what the foundation is looking at.
Okay, so I'm wearing multiple hats. So the Sickle Cell Foundation, our job really is to advocate for the improvement of care for sickle cell patients. As we touched on, Professor Himfrimpong was able to bring newborn screening to Ghana, and that is fantastic. His legacy will live on through that work. I'm very pleased that the Ghana Health Service is taking this on, and we are partnership with the Ghana Health Service really as a consulting role, just giving them advice for them to roll out newborn screening throughout the rest of the country. So the foundation has really done a great job on that. Now, there are treatments for sickle cell disease. Bone marrow transplant will treat someone with sickle cell disease.
It's a complex situation.
It is,
of course.
but it's been done elsewhere, right? And so gene therapy will treat sickle cell disease. So the foundation is really going to focus on this treatment. We've already mentioned hydroxyurea, which is a pill that you take, but it does not cure the disease. It helps you manage the disease. So foundation moving forward is going to be really focused in how we advocate and we lobby government to bring these high-tech treatments to sickle cell patients in this country.
And speaking of this bit you mentioned about bone marrow transplants, I found it rather interesting because only recently I was reading about someone who I think is just the fourth person who supposedly has been cured of the acquired immunodeficiency syndrome, AIDS, as we call it. He has a name that I've forgotten. You know, they name them based on where it is that this happens, Berlin or something of the sort. And it was on the back of a bone marrow transplant for something completely different. But somehow it ended up, you know, transforming. So that is how crucial some of these medical interventions are, really. Unintended, but very good outcomes. But let's talk about personalized healthcare and where that is headed. There is this project ongoing which contributes towards personalizing healthcare in Ghana, but there are also different dynamics because sometimes, you know, the over-the-counter approach that we have in Ghana and how sometimes it becomes a bit unchecked and people sometimes even impact themselves negatively on the back of that. How do you find that development in Ghana? Where would you say this should get to? And can we get to the point like in the West where this is more of the norm, basically? It's nothing strange, but here it's still something that is in the teething stages.
I mean, over-the-counter medication is not unique to Ghana. You know,
it's everywhere, basically.
Yeah, you buy medications, you know, over the counter in the U.S. and London and in Ghana. There's no problem there. We have actually, you know, very good pharmacists in this country who can give you advice when you go to see them, whether or not, you know, you can buy something without going to see a physician. But it's always best to consult with a physician.
It's like the malaria drugs. You can go without a test, but if you don't have it, I mean, what you could end up with as consequences over time could be disastrous.
Yes.
So that's a typical example.
It's always good to seek a physician's advice before you take medicine. I mean, that's just, you know. So if anybody's listening, yes, if you're not feeling well, don't self-diagnose and then go and purchase medicine. See a physician. Very simple.
So with your foundation, to wrap the conversation, with what you're doing, what is the next step and your target populations across the board? What are your projections moving forward? What can we expect from the Gh Genome Project?
So the Gh Genome Project has four basically components. The first one is basically a public lecture series. The first is going to be on the 24th of August. And so you're all invited to the Great Hall.
Where is this happening?
The Great Hall of the University of Ghana, where the Gh Genome Project will be launched. The second is we're going to offer free screening for sickle cell disease, prostate cancer, breast cancer. We're going to do this first one in collaboration with the traditional leaders of Osu, La, and Kole Gono. We are yet to fix a place, but most likely it will be at the cathedral, most likely. The third component of the Gh Genome Project is offering scholarship for Ghanaians to be trained in all aspects of genetic medicine. We're starting with genetic counseling. Very soon we'll start a new program in MPhil, Master of Philosophy, and a PhD in medical molecular genetics. The final one, the fourth one, is the sequencing that we talked about. Our plan is to sequence 1,000 Ghanaian children, 500 with sickle cell disease. We've already secured the funding to do that. We'll be looking to corporate Ghana to help us find money for the other 500. Once the launch is completed on the 24th of August in Accra, then we'll go on a regional tour. The very following week, we'll be in Cape Coast, giving a public lecture again at UCC, followed with free screening for the disorders I mentioned in collaboration with the Ugwa traditional area as part of the Afeshe Festival. Then we'll keep on going. We'll go to Wa, we go to Ho. The idea is to make a lot of noise so that everybody now appreciates awareness. Right. And this is where, thank you again for accommodating us this morning to share the news of the GH genome and the importance of genetics in our health. Ultimately, we hope that we'll raise enough awareness that people will be aware of their genetic status as much as people talk about their HIV status. Right? We want to, basically, this is where we want to reach. Know your genetic status with respect to sickle cell disease, your risk to prostate cancer, your risk to breast cancer. Know all of these things. Then you'll be able to have make a better informed decision about your health.
And it's important that we do all of these. Interestingly, I checked my PSA. I know you understand. I'm not going to recently.
And it was low.
Tip-top shape.
Excellent.
Tip-top shape. Excellent. We thank God for the little mercies.
Yes.
Yeah.
That is great.
But definitely, Prof. Koff may not be with us, but we do have Professor Solomon Fifi Oforiakwa, president of the Sickle Cell Foundation, who is undertaking this brilliant exercise. We wish you and your team the very best.
Thank you very much.
All right, so that's how we sew up this conversation, but there's a lot more coming your way. We're just 2 days away from the second clinic of the EcoBank Joy News Habitat Fair at the West Hills Mall. If you thought the Achimota Resale Center was good, this is going to be bigger. Ahead of that, we're having interactions with two of our sponsors, Cities and Habitats and Virtual Security Africa. All of that up next on the AM Show. Tuesday.